On the COVID front tonight, Bay Area epidemiologists are weighing in on California's new mask rule.
It takes effect in 2 days, regardless of vaccination status, and comes as the state is experiencing a spike in COVID cases. KPIX5's Kenny Choi is here with what he found out tonight. Kenny?
Liz and Ellen, tonight I spoke to a top epidemiologist who says that science is not being followed with these new mandates, but the State Department of Health says that the move is necessary, so further restrictions don't have to be considered.
Masks will be required again statewide in gyms and other public indoor spaces starting Wednesday for at least a month.
We're disappointed that the state is applying a one-size-fits-all mask mandate.
UCSF's Dr. Monica Gandhi believes restrictions should be based on local vaccination rates and hospitalizations, but not the overall state case count.
What's on my mind is the trust of us as a population to believe that our public health officials are following science.
She points to Marin County, where for the last month, mask mandates were lifted and hospitalizations remained very low. Gandhi also says look at Los Angeles and Orange County post-vaccines.
OC didn't put back masks, LA put back masks. Zero difference in cases and hospitalizations because they had the same vaccination rate, which I think proves how strong vaccination is and how much more powerful of an intervention it is over masking.
But Dr. George Rutherford argues against using hospitalization metrics to dictate policy until real-time hospital data is readily available.
But how many people are newly coming into the hospital, which is what we need to know to establish epidemic trends, is a little bit more difficult to come by. If that were readily accessible, I think she's completely right. But until that day dawns, I think we need to continue to follow the sorts of things we follow.
What health experts agree on is improving the numbers in unvaccinated populations will make a difference.
So, Kane, what else is the state health department saying about the new mandate?
Yeah, so state health officials are saying that even a small increase in indoor masking can help prevent the spread of the virus and also therefore prevent the hospitalizations, or hospitals rather, from filling up. So that's why they're implementing these new mandates once again.
And that's what we want. We want to keep the ICU beds available.
Exactly. Yeah, but the key, of course, vaccinating the unvaccinated.
Exactly. Yeah. Okay, Kenny, thank you. California is also tightening testing requirements. Unvaccinated people will have to show a negative test to attend indoor events of 1,000 people or more. And the state also recommends travelers get tested within 5 days of their arrival in California. And for information on how to get your shot or booster, head to kpix.com for our coronavirus vaccine guide.